Thank you for choosing Manatee Memorial Hospital's Orthopedic and Spine Surgery Center. We're grateful you've selected us for your care and are proud to provide you with access to our nationally recognized patient-focused hip and knee replacement program. Let's get started. The goal of this video is to provide the information you need before, during, and after surgery. It will include the procedure, hip or knee replacement, time of surgery, what to bring, day of surgery, pain management, post-surgery, recovery, physical therapy, and discharge. For total knee replacement, your surgeon will remove the damage or arthritic bone and cartilage from your thigh bone, shin bone, and kneecap and insert a prosthetic or artificial joint. This prosthesis is adhered to the bone using surgical cement. The prosthesis is made of alloys of cobalt, chromium, and titanium, and the cartilage replacement device is a high-grade wear-resistant plastic or polymer agent. This new knee is ready to bear your full weight hours after your procedure. A total hip replacement consists of removing the damaged area of bone and cartilage from an acetabulum or socket part of the hip and replacing it with a prosthesis. The surgeon removes the damaged ball or head of the femur and replaces it with a metal ball and stem prosthesis together. These prostheses replace the natural ball and socket hip joint. A total hip replacement can be done from an anterior approach where the incision is at the front of thigh or posterior approach where the incision is close to the buttocks. Your surgeon will decide which approach is suitable for you. Time of surgery. You'll receive a call the day before surgery from a nurse in the surgery department who will let you know the time of your surgery. If your surgery is scheduled for Monday, the call will occur between 2 and 6 p.m. the Friday before. During this call, the nurse will tell you if you need to take a specific medication on the morning of the surgery. Some examples might include a beta blocker, blood pressure medication, anti-seizure medication, or some of the long-acting pain medications. The nurse will specify what medication you take, if anything, and what time you need to take it. If you are unavailable, the nurse will leave a message at the number you provided. What to bring to the hospital: ID and insurance cards, advance directives, and living will if these documents are applicable to you. Regular comfortable clothes such as shorts, t-shirts, loose-fitting dresses, pajamas, etc., as you will be up and moving as quickly as possible after surgery. A list of current medications and supplements. If you suffer from sleep apnea and use a CPAP machine, please bring your device with you to the hospital, as it's important to use your CPAP as prescribed. After anesthesia and pain medication, shampoo, body washes, lotions, etc. can be brought, as you will be allowed to shower in the hospital. In your private room, there's free Wi-Fi access, so you're welcome to bring your cell phone and other electronic devices. Walkers. Our physical therapists will adjust your walker to the correct height for you and fit tennis balls to the back of it to protect your flooring at home. You will need the walker for approximately 2 weeks after surgery. We do not recommend crutches, as they provide less stability than a walker. Ideally, a walker with 2 wheels on the front and 2 stable legs on the back is the best type to get. You can borrow one from a friend or community closet. Home preparation. Before surgery, take time to look at your home. In preparation for discharge, remove throw rugs, tidy up electrical wires and anything that could trip you up, freeze some nutritious meals, or accept the kind offer from family members or neighbors to drop off some meals to you after your return home. Elevated toilet seats make it easier to get on and off the toilet, particularly following posterior hip replacement surgery. A 3-in-1 commode provide an adjustable frame which fits over an existing toilet. Some insurance will cover the cost. Constipation is caused by narcotic medication, which is used to manage your pain. We suggest that you pick up a stool softener and a laxative over the counter at your pharmacy to have on hand home should you need it. Day of surgery. You will need to have fasted the night before surgery, which means not eating or drinking anything after midnight. When you arrive at the hospital, check in at the registration desk. They will direct you to the surgical waiting room. You will be provided with information on our EASE app, either from your physician's office or at your pre-admission testing appointment. This app allows us to contact a family member or friend to be informed of your progress through your surgery and recovery. Your surgeon will come to the waiting room to speak to your family members once your surgery is complete. While your surgery will last between 1 and 2 hours, your family members should expect it to take from 4 to 5 hours before you'll be in your room and they can see you. When you're taken back for surgery, you'll go to the pre-operative department where you will meet your pre-op, surgical, and anesthesia team members. The area around the surgery site will be shaved. We ask that you do not shave that area for 3 days prior to your procedure. This is for infection control purposes. As we do not want any grazes or nicks around the surgery site, your surgeon will come along and mark your operative leg with the word "yes" in indelible ink. This is standard international safety protocol. Your anesthesiologist will review your health and medication history with you. Our joint replacements are done under either general anesthesia or regional spinal anesthesia. Your anesthesiologist will decide which method is suitable for you. Please know that you'll be asleep for the duration of your procedure. You'll be taken to the Post-Anesthesia Care Unit PAC-U, formerly called the Recovery Room, for one-on-one monitoring to ensure you are stable. Some people discharge home directly from PAC-U. If it is decided that you are staying overnight, before we transfer you to the Orthopedic Unit. The Orthopedic Unit is called 4 South Tower. You'll have a waterproof dressing on your incision, which allows you to shower. Our team will get you up and moving the day of surgery, which is a milestone in your recovery. Pain management. Pain management is a priority. Our healthcare team members are committed to managing your pain effectively to maximize your functionality. We begin treating your pain in the preoperative area and continue all the way through your hospital stay and through your recovery period. At home, pain is a natural protective phenomenon. In response to this new surgery, your brain is telling the rest of your body to go easy on this new joint and allow it time to heal. While discomfort is expected, our goal is to make it manageable and controllable. We will give you oral pain medication to stay one step ahead of the pain. Oral pain medication takes 20 to 30 minutes to work and stays in your system for approximately 4 hours. IV pain medication will also be available to you as a rescue pain medication. It has a faster onset, however your body metabolizes it faster on a regular basis. We will ask you to rate your pain for us from 0, which is no pain, to 10, which is the worst pain you could ever imagine. Our initial goal for you is 4 or below. On that scale of 0 to 10, as we want you to be comfortable enough to eat, sleep, watch TV, but most importantly, attend the physical therapy exercise sessions, as these are the key to the success of your new joint. Our nurses and therapists are highly skilled in assessing and managing your pain and helping you to set an acceptable comfort goal for you. ICE will be your best friend from the day of surgery until approximately 6 weeks after surgery. Our program is a very structured, evidence-based practice approach to joint replacement. Part of that approach is the appointment of a coach or caregiver. They become your personal cheerleader throughout this journey. Most importantly, we invite them to attend physical therapy class with you to learn what you need to do to ensure successful recovery. If you're being discharged from PACU, our physical and occupational therapists will evaluate you prior to leaving. Your coach is welcome to be present for this evaluation. If you stay in the hospital group, physical therapy sessions will occur. Our physical therapists will get you out of bed on the day of your surgery and do some gentle mobilization with you. They will teach you some safety precautions and how to use your walker in group physical therapy. For our hip replacement patients, we will provide you with a hip kit which contains implements to help you adhere to your hip precautions. Following posterior approach, hip replacement hip precautions are necessary for a period of 6 to 12 weeks to protect your new joint and allow for bony growth around the prosthesis to anchor into place. Nursing, physical therapy, and occupational therapy will work closely with you to ensure that these rules are easily translated into real life. In other words, we will teach you how to get your socks and shoes on, how to get in and out of your car, and how to safely accomplish other day-to-day activities while protecting your new hip interior approach. Hip Replacement patients have less restrictions or precautions, and we will ensure you are comfortable and clear on your specific precautions prior to going home. Total knee replacement patients should not prop the new knee up on a pillow or rolled towel when lying in bed or sitting in a recliner. We want the knee in full extension, and periodically placing a rolled towel under the ankle area will assist with this extension. However, if the knee is swollen and you wish to elevate it, place pillows from the thigh to the toes to keep the knee as straight as possible while elevating it going home. The usual length of stay in the hospital following total hip replacement or total knee replacement is 1 night. Discharge generally occurs the day after admission. Most patients go directly home from the hospital, where we know you will sleep and rest better, and your overall recovery is expedited. Your surgeon and his team will determine if you need outpatient physical therapy or home health care set up for your recovery phase. We will ensure that this is organized and in network with your insurance. Once you're home, your coach will be involved in the discharge process to ensure everyone is confident, competent, and ready to embrace the recovery phase. Every surgery comes with a potential risk of complications, and is our job as your healthcare team, with your participation, to ensure that we minimize these risks to you. Every patient will be put on blood thinning medication after surgery to prevent blood clots. Some surgeons choose for you to wear elasticated compression stockings after surgery in the hospital. We also use sequential compression devices, which inflate and deflate at regular intervals while assisting the circulation. But the best defense against blood clots is walking. Walking also helps to expand your lungs, fully cough, and breathe deeply, thereby helping to prevent respiratory complications. Swelling is expected after surgery. Maximum swelling occurs between day 5 and 7 post-operatively. Do not be alarmed. Keep doing your exercises and walking. Use your ice and elevate your leg. We suggest that you take a stool, softener, and/or laxative to alleviate the constipation issue, or as long as you take the narcotic medication. Be sure to eat healthy meals and stay hydrated before and after surgery. Your surgeon will send a prescription for your post-operative pain medication and blood thinning medication to your preferred pharmacy. A family member or friend can pick them up for you by providing their own photo ID for the best success. Do your exercises twice a day, every day, and walk frequently. Should you have any questions or concerns, call your orthopedic surgeon's office.